This video is for those looking for ACA, HSA strategies, and I'm going to talk about the problems. And this is all for those retiring prior to age 65, or if you need to get health insurance from the exchange and we're thinking about getting a high deductible health plan, some of the problems and pitfalls. This presentation was initially made for financial planners who are operating and have clients in Hawaii, but the concepts are very universal for anyone who is shopping for plans. And if you want more details in how I did this and the actual protocol and steps that I follow, please let me know in comments below, and I can go ahead and make more videos like this and go over the breakdown as how I came about my conclusions. All right, we are going quick though, because I do have 63 slides. All right, so first I can guarantee that this will be a good slideshow, a bad slideshow, or somewhere in between. Now, some basics. So we're going to be talking about health insurance, and the health insurance that I'm going to be talking about is health insurance from the marketplace, otherwise known as healthcare.gov, and sometimes called major medical. For those of you folks who need visual, this is what healthcare.gov looks like, and this is the government website to enroll and pay for your health insurance. This is the official one. I have my own that I use to quote and enroll my clients, but you can use this one or the one that I use as well. We're also going to be talking about high deductible health plans, otherwise known as HDHP. This is a special type of health insurance from healthcare.gov. Remember, high deductible health plans and the qualifications for high deductible health plans need to be bought from healthcare.gov or from web platforms like eHealth Insurance and the health platform that I use, which is called Health Sherpa. So high deductible health plans must have the minimum deductible and maximum out of pocket within the annual limits to be considered a high deductible health plan. And if you have a high deductible health plan, you're able to get an HSA. So health savings accounts, otherwise known as HSA. It's a special tax favored account that contributions can be made to only if you are currently enrolled in a HDHP. So what is an HDHP? Well, the high deductible health plan classifications are here shown on the screen. So what basically this means is your health plan has to have a deductible of at least $1,500 for an individual, $3,000 for a family in 2023, and the maximum out of pocket cannot be more than $7,500 for your individual or $15,000 for a family. And all those numbers are here. Next. So what is health insurance as defined by the marketplace in the ACA? Well, there's actually two criteria that make an ACA plan, and they're very simple. They have to cover the 10 essential health benefits and be financially standardized by Met-Health. So you might be wondering, what are the 10 essential health benefits? Well, these are the 10 essential health benefits that health insurance of the marketplace have to cover. Quite simple, but can get very confusing when broken down into actual services. We'll get into a little bit of that later. The second qualification is that it has to have a metal classification. Now, bronze all the way to platinum basically just talks about the financial amount that you are paying and the insurance company is paying. So on average, you'll be paying 40% on a bronze plan, and then 30% on a silver, 20% on the gold, and 10% on the platinum. For an easy example, let's look at some popular coffee sizes. So when you get coffee, any kind of coffee you get, all the cups have the exact same ingredients. It's just the amount you're getting changes. In other words, coverage, or the coffee, doesn't change. The amount of financial protection, though, the size of the cup, does. For those of you who are nerds, the actuarial value is what the plans are standardized on, and it's based on this template. So it goes a little more than just 10, 20, 30, 40% co-insurance. But I mean, if people were to actually take these things into consideration, they probably drive themselves insane. And plus, each individual plan will have individual co-pays, co-insurances for the different services, which is why some companies offer multiple gold plans, multiple silver plans, and multiple bronze plans. So, all this, what about an HSA? So, for HSA, there also has to be 2 criteria met. And those are the minimum deductible and the maximum max out of pocket. And for a quick refresher, here are those numbers again. All right. So if the minimum deductible is too low, meaning this is like $1,000, it cannot be a high deductible health plan. By the same token, if one of these, the maximum out of pocket, the self only, is above $7,500, that also can't be a high deductible health plan. And we'll go over one plan that fits that, where the maximum out of pocket is actually higher than the HDHP maximum out of pocket annual limit is, and therefore it's not an HSA. But the deductible is more than $1,500. All right, so it sounds great, but here's the reality for folks in Hawaii. Now, if you live in a different state, it's going to be different, but for the presentation's sake, this is what we have found. So there's only one high deductible health plan that's available in Hawaii, and the deductible for that plan is $6,900. Now let's run an example of the different options that a female age 60 in Honolulu has. All right, so we have the cheapest plan here, which is the HSA eligible plan, $800 a month. Like I said, there are different levels of the same gold medal level, but different plan. This plan actually has a deductible of $2,000. Now that does fit our definition for the minimum deductible, but if you see right here, the max out of pocket is higher than the annual limit is, so this is not an HSA qualified plan. Next we have the gold PPO 1 and then the platinum plan. So the difference between the monthly premium of the cheapest and the most expensive is just under $400 a month. So just about $4,700 a year or so. So given this, these are your options. How would you make a decision? What would you choose for yourself? All right, we have covered a lot, but before we move on to advanced level, I would like you guys to let me know in the comments down below if this was helpful, if you are learning something about the health insurance on the marketplace, and if you have further questions, leave them and I will do my best to get a video out for you folks. All right, so here's the example again, but what I did was I took the platinum plan, broke it down to its little components, the maximum, minimum components, premiums, deductible, max out of pocket, cost sharing level, and the maximum total financial risk, which is the premiums plus the annual max out of pocket. I did the same for the high deductible health plan. And I found that the premium savings of buying the high deductible health plan over the platinum plan is about $4,500 a year, which means if you were to purchase this plan instead, you would save $4,571 if you had absolutely no medical costs. The maximum financial risk, as you might be noticing, is less than the platinum plan. And that's simply because the max out of pocket plus the premiums is only $16,614 versus the premium plus plus maximum out of pocket, on the platinum plan is a little more, $671 more. But this spreadsheet tells us the absolute worst case. So what happens if you are someone who's healthy? Can you save money? First, we have to answer the question of how much do medical services cost if you have to pay the full price. But first, did you know that certain medical services are likely to push you to the max out of pocket even if you have co-insurances of 20 to 40%. So on high deductible health plans, you'll get there even faster. The Platinum Plan copays on expensive services will save you more money even if you have just one major medical event. Now this is specific to the plans that I'm talking about. You'd have to go into detail on plans available in your area. But for this example, I'll show you how the numbers work out. All right, so how much are medical services? We'll throw out an easy one first. So, a doctor visit. According to Fair Health Consumer, if you are in the Honolulu area, a 20-minute doctor visit outside of the facility, not attached to the hospital, is about $107. Now, if it's a 40-minute doctor visit, it goes up to $213, and if you tack on the facility fee, it goes up to $584. So it can be quite expensive. Now, if it's a new patient or an ER follow-up visit, those can be even higher. All right, so let's run a very simple scenario. We're going to have Miss Lee, who's age 60, recently retired. One day, she experiences severe chest pain. Now, here's what most should do. I'm not a doctor. I don't really know if this is what you should do, but I think if it was me, this is what I would do. I would call the ambulance. The ambulance would take me to the emergency room, and then they'd run some tests. All right, so how much do those things cost? So, a standard ambulance ride. A standard ambulance ride is about $1,370 plus the cost of everything else. As you can see on this screen, routine ECG and medical supplies and services are not added yet, which would add another $282 or so to this cost. So it's quite expensive. Well, how much will they pay with the insurance? Well, if they're on the Platinum Plan, their cost share is 10%, or $137 in this case for the flat rate of the ambulance fee, not including the additional a la carte items. High deductible health plan cost share would be the entire amount, or the $1,370 plus the miscellaneous a la carte items. Kind of expensive. All right, that's still not factoring in the emergency room visit. So how much is an emergency room visit? A high-level ER visit without diagnostics or procedures at a hospital where most likely you'd be taken to is $2,381. So how much are you paying on insurance? Well, the Platinum cost share is a flat fee of $100. Of course, the high deductible health plan is going to be the full amount of $2,381. Now, we still got that blasted MRI scan. It might be a CT, whatever it is, but most likely, if you're in the ER, they'll give the one that gives the best clarity. It's probably an MRI. Now, again, I'm not a doctor, I don't know, but this is what I can at least guess. So a chest and abdomen MRI is $3,062. And of course, the anesthesia is added because you need that, because they're not going to have you do the MRI without that most likely, especially if you are experiencing chest pain. So how much does it cost on the insurance? So with the Platinum Plan, it's $100. Now, if you are admitted to the hospital, it is not, there's no charge because you are in the hospital and you get covered under hospital stay copay. On the high deductible health plan, you are paying the entire amount. So, what if you had a heart attack? Well, a heart attack with low to no complications and just a comorbidity is $27,000, and that's just for one day. If you have more days, it adds another $18,000 a day. What about on insurance? Well, for the Platinum Plan, you're paying that flat hospital inpatient stay of $350. On the high deductible health plan, you're paying $6,900 because that's the most you can pay for one whole year. So at least you're not paying the full $27,000. All right, so this is a comparison of how much each plan costs. If it's not a heart attack, it's just we'll call it a scare. So as you can see, the Platinum plan, our total cost is $337, while on the high deductible health plan, it is all the way at $6,800, almost hit your max out of pocket. So let's summarize. One heart attack scare costing at least $6,813 consumed all of the $4,571 premium savings. So if you used your HSA, you would have used all of it. On the Platinum plan, it was just $337. So now if you look at the total cost that you have spent in 1 year, granted this is all that happens, the Platinum plan was $14,623, while the high deductible health plan is $16,527. So the high deductible health plan would actually cost you more with just one of these, one health scare. Now again, this plan is unique to Hawaii, and the area code, zip code 96813. But if you want to learn how to do other ones, I can definitely go over other plans if you were interested. So is the high deductible health plan plus HSA better? Next, just to quickly recap on some more items that people wonder about, cancer treatments. One cancer treatment is about $2,000. On a plan, Platinum plan would be $350. High deductible health plan would be the entire amount. I know, kind of repetitive. What about a colonoscopy? It can't be that expensive, right? Well, a colonoscopy at a hospital is $1,474. And for this one, if you wanted anesthesia, which most people would probably want, it's an additional $597. So about a little over $2,000 for a proper colonoscopy. On the health plan, it'd be $150 for the Platinum and the full cost on the high deductible health plan. All right, I'm pretty sure you got it down. So how would you decide? Quick recap on the coffee. We all know that to get 20 ounces of coffee, it's cheaper just to get the venti than getting a tall and a short, right? You're not going to go to Starbucks and get a short and tall and drink both of them one after the other when you could just purchase a venti. It wouldn't make sense. In the case of high deductible health plan plus HSA, what we're saying is that we'll buy the tall and short coffee to potentially save the short coffee for later. Sometimes it works, and sometimes it doesn't. All right, so what are the pros of having a high deductible health plan and an HSA? It allows you to save some of that premium for the future. Instead of paying the premium to the insurance company, you get to keep some, right? And also you have a clearer picture on how much you are spending on medical and how much medical is costing you. Now the cons. Medical costs add up quickly, as we've seen. And the money saved from the premiums can be gone quickly as well. You will require more emergency funding. And typically HSAs would need to be set up with certain companies, HMSA in this case with this example. And me as the broker for the health plan do not have any control over the HSA. So I wouldn't be able to help on that front. So Matt, what's the next move? If you really wanted a high deductible health plan and an HSA, I would strongly advise getting cancer, heart attack, and stroke insurance. Now, what this does is it provides funding to protect the money in the HSA from the more common medical emergencies. This is also known as critical illness insurance. It helps cover the major gaps in the high deductible health plan costs. And if you're someone who's retiring soon, it covers the same Medicare plan gap so that you don't have to buy it again or you don't have to buy another policy when you retire. The cons. It doesn't protect against false alarms. Remember, even though this person only had the ambulance ride, ER visit, and the diagnostic test run, the MRI, they still racked up $6,800. This requires more insurance management. Right? Now you have a high deductible health plan, which you have to keep track of that deductible, an HSA where you have to keep track of the health savings account, and a cancer, heart attack, and stroke insurance. So it may not also fit with people who are in the mindset of buy less insurance, save more money. But wait, you know your client or you know you. Would you be able to handle bills like this? Manage the record keeping. Lastly, tax consideration. Now, I'm not a tax professional, but premiums that are used for the ACA, healthcare.gov, Affordable Care Act plans are 100% tax deductible on a 1040. Medical costs, on the other hand, you have to itemize with Schedule A, and your medical expenses have to be more than 7.5% of your AGI, adjusted gross income, in order to deduct them. Other factors that I have not covered here, but I can in a future video if you'd like me to go over them. Premium tax credits based on income level. So for people who are retiring, they have lots of assets. If you can get your income low enough, you may be able to qualify for premium tax credits to make your insurance cheaper. Short-term medical plans. Recently, these were labeled junk insurance, which I would not recommend. I can talk about them if you so desire. Health insurance plans that are no longer available for those once they hit 65 and above. Alzheimer's insurance, critical illness insurance. Many of these policies are only available for those who are still 64 and younger. And how to enroll, right? We didn't cover the qualifications to enroll in the plan, what you have to do on healthcare.gov to enroll in a plan. This can take some time as they require a lot of information and sometimes documents to be uploaded to healthcare.gov. I didn't cover drugs, and I didn't cover dental, vision, and hearing, which is not included and is not one of the 10 essential benefits. So you will have to get those things as well. Lastly, so who would benefit, right? Who would benefit from a high deductible health plan and a HSA? For those 3 years away from retirement, you could use what I have and I use, which is called a health matching account. I would suggest the health matching account $1,500 to build up your account value to the maximum. In this case, we use that account because the deductible for the account would be about $6,900. Over the 3 years, you would put in $7,100, and this would make your health matching account be worth $1,500. And the way the health matching account works, for those of you, a quick rundown: once you hit the maximum, you just pay a small maintenance fee. And whenever you use it, it takes 1 year to replenish half of what you've already made. So if you did this, you paid for the whole deductible, $6,900, it would take you just about a year to build up back to $1,500, even though you're really only paying about $2,400 for the whole year to get $7,000 in medical like savings or medical expenses. So a client or someone who really would want to do this is if they find value in really micromanaging their healthcare spending, then we can go on and have a second conversation. I hope this helps. If you have any questions, let me know. I'll be happy to try and answer them, make another video, go over my thought process on why this is so, and hopefully we'll see you in that video.